Are there country-specific risk factors for colon diseases? When we think about colon diseases, including colon cancer, it's important to recognize that these conditions are influenced by a mix of genetic, environmental, lifestyle, and metabolic factors. While some risk factors are common around the world, there are specific patterns that vary by country. These differences often reflected unique dietary habits, lifestyle choices, healthcare access, and the prevalence of certain health conditions. Let's start with dietary patterns and lifestyle. In countries where a Western-style diet is prevalent, we see higher rates of colon cancer. This diet is typically high in red and processed meats, refined grains, sugars, and saturated fats. The United States is a prime example, where rising obesity rates and these dietary habits have led to an increase in early-onset colorectal cancer, especially in adults under 50. Similar trends can be found in the United Kingdom and parts of Europe. In contrast, countries that emphasize diets rich in fiber, fruits, and vegetables tend to report lower colon cancer rates. Thus, diet plays a crucial role and varies significantly from one culture to another. Next, we have obesity and metabolic conditions. Obesity is a major risk factor for colon diseases worldwide, but it is particularly concerning in countries like the United States, where obesity rates are climbing rapidly. Obesity can lead to chronic inflammation and insulin resistance, both of which can increase cancer risk. Additionally, conditions like non-alcoholic fatty liver disease, which often accompany obesity, also elevate the risk of colon cancer. These metabolic issues are more common in countries with sedentary lifestyles and diets high in calories. Emerging research is also highlighting the role of microbial and environmental factors. The gut microbiota and certain bacterial toxins, such as colobactin from specific strains of Escherichia coli, can damage colon cells and promote cancer. While this is a global issue, the composition of gut microbiomes can differ across countries due to variations in diet, sanitation, and antibiotic use, potentially affecting colon disease risk. Furthermore, genetic factors and healthcare access can influence colon disease risk. Some populations may have genetic predispositions that affect their risk levels. Additionally, differences in screening programs and healthcare systems can impact how effectively colon diseases are detected and treated. For instance, certain European countries may have higher incidence rates due to either genetic factors or more comprehensive screening practices. Lastly, we observe global trends and variations in colon cancer incidence. While the overall rate is rising, the speed of this increase and the age distribution of cases can vary widely by country. For example, early-onset colorectal cancer is increasing sharply in the United States and England, while other nations may exhibit different patterns based on local risk factors. In summary, while many risk factors for colon diseases are universal, such as smoking, alcohol use, obesity, and diet, country-specific risk factors often arise from differences in dietary habits, obesity prevalence, metabolic health, microbial exposures, genetics, and healthcare systems. Understanding these variations is key to developing effective prevention, screening, and treatment strategies. For personalized risk assessment and management, individuals should always consult healthcare professionals.